Well, we got a wonderful speaker for you, and I want to introduce June Sivilli. June Sivilli is the Division Chief for Public Health and Public Safety in the Office of Public Policy Research and Budget in the Office of the National Drug Policy Executive Office of the President. She has spent the last 8 years working in expanding access to treatment, including medication-assisted treatment for opioid use disorder. She has also worked on workforce issues in health information technology, integration of substance use disorders into the mainstream health, and the SPERT program, which some of you may not know is the screening and brief intervention and linkage to treatment. June has extensive background in international policy, representing the United States at the United Nations and other international bodies. And prior to her work in the government, which has been 20 years in the office of, I guess I wasn't supposed to say that, but she was only 19 years old when she actually joined the federal government. So prior to her work in the government, she was a researcher in the private sector. This is a particularly important topic for us because President Obama, as you know, has identified opioid use disorder and the excessive use of narcotics in this country as one of the major health problems of the country. And in fact, we were talking about this last night, that the vast majority of opioids in the world, the vast majority of prescriptions for codeine, oxycodone, are written in the United States. For some reason, having only 300 million people, we consume the vast majority. Someone used a number like 90%, and I was like shocked. I haven't checked that number, but it is some astronomical number, so much so that prescription drug overdose deaths are much more common than people who use illicit drugs, for example. And so this is definitely a defining health problem for our generation in the United States. It has major cultural impact, social impact, and risks undermining the fabric of our society unless we address it head-on. We are, of course, for that reason, at the ECHO project, this is one of our front and center projects. Even though we started Project ECHO for hepatitis C, we put a majority of our attention on this one project because it has the potential for such a massive change in the United States. And my colleague, Dr. Miriam Kamarami, has developed this amazing model of combining a community health worker with a clinician, training them both to become experts in substance use disorders, and then working as a team to work on the social, psychological, cultural factors, poverty, homelessness, all together on one end, the community health worker, and then the physician who's also being trained in behavior change, plus the science of opioid addiction and the medicine treatment. And so we are particularly honored to have June here to speak to us about the President's initiative. And of course, we would be honored to be able to help in even the smallest possible way to solve this opioid epidemic in this country. And thank you, June, for coming all the way from Washington.
Well, hi, everyone. First, I want to say thank you so much to Sanjeev for that very nice introduction. I also want just to let everyone know that Director Botticelli is ill. He really did want to be here, and he's home resting. He got sick just like the rest of us do, and he's home in bed. And we want him to stay there all week. But we've already got him scheduled to do stuff next week, the poor guy. So all of that to say, I am truly honored to be here to speak on his behalf. I have worked, thanks Sanjeev for telling people that I've worked at ONDCP for 20 years. I have an extensive experience working the drug policy issue, and I think we're all aware that we are at the precipice of attention from Congress because of this opioid epidemic. So Thanks, Sanjeev, for the nice introduction. Thanks to Miriam Kamarami for all of her great work on substance use disorders through the MetaECHO project. Thanks to all the speakers who are here, and also to all of you for being here. So I'm here to talk about the opioid epidemic and how we can work together to end it. I'm going to update you on the federal response and talk about what you can do to make a difference. Before that, I want to lay out the challenge that we're facing. I think Sanjeev gave us a kind of a brief viewpoint into it, but we do know that in 2014, there were more than 28,000 opioid-related overdose deaths. So if my boss were here, he'd say that's about as many people as fit into Fenway Park when the Red Sox are playing. It's a lot of people. And it means that opioid-related overdose deaths have more than tripled in 15 years. And quite frankly, that's staggering. And while the overdose epidemic is a problem for every community across the country, it has really hit New Mexico harder than most other states. In 2014, the drug overdose death rate in New Mexico was 86% higher than the national average, with more than 27 deaths for every 100,000 people in the state. And during the 2010 to 2014 time period, Rio Arriba County ranked 4th in the nation in drug overdose deaths. Everyone in this room would agree that we can't let this continue. That's why we're all here, to end this crisis and prevent more people from going down this path. The good news is that research shows that substance use disorder is a disease of the brain. It's one that can be prevented, treated, and people can recover. The millions of Americans living in recovery today are the proof of that. And that's why it's so important that we expand access to treatment all across the country, from Albuquerque to Anchorage to Atlanta and everywhere in between. And with Project ECHO's hub and spoke model and their network of care, which I understand reaches 22 states and 5 nations, is pretty impressive, and it reaches many places where specialized care is scarce. You have an important role to play. President Obama has made clear that ending this epidemic is a priority for his administration, and he's shifted our approach to one that focuses on a public health approach more than ever before. A week ago, he traveled to Atlanta for the National Prescription Drug Abuse and Heroin Summit, and there he announced new public and private sector actions to address the epidemic. One, the Department of Health and Human Services has issued a proposed rule to double the number of patients a doctor can prescribe buprenorphine to. We've all been waiting for this. This would expand access to medication-assisted treatment and behavioral health supports to tens of thousands of people with an opioid use disorder. This has been a top priority for the administration for many years, and research shows that this approach, when combined with behavioral therapies, is more effective at sustaining recovery and preventing overdose. The president also issued a presidential memorandum and took other actions to make sure that parity regulations are properly implemented across the country so that people with substance use disorders and behavioral health disorders can get treatment just like someone with any other physical ailment. We also need doctors to be trained in safe prescribing practices. That's why more than 60 medical schools announced that beginning this fall, all students will be required to receive prescriber education training that are in line with the newly released Centers for Disease Control guidelines for prescribing opioids for chronic pain. This is an important step forward in preventing opioid use disorders. Beyond that, national pharmacies have committed to making the life-saving opioid overdose reversal drug naloxone more widely available. These actions build on what President Obama announced in West Virginia last October and what he's done since the beginning of his presidency. Excuse me. To date, thanks to his actions, approximately 75% of federal prescribers have been trained on appropriate prescribing practices. And federal agencies have taken steps to expand access to opioid use disorder treatment. For example, TRICARE, who is a healthcare provider for DoD employees and families, has an estimated 15,000 to 20,000 beneficiaries with opioid use disorders who cannot access medication-assisted treatment under the current benefit. So the Department of Defense has issued a regulation, a proposed rule, to implement mental health and substance use disorder treatment parity protections in TRICARE, including coverage of intensive outpatient programs and treatment of opioid use disorders through medication-assisted treatment. This is a big deal. Last month, the administration released new Centers for Disease Control prescriber guidelines that I just mentioned to help healthcare providers provide safer and more effective care for patients dealing with chronic pain. And it's important to note that going back to the first annual National Drug Control Strategy in 2010 that was established under this administration, and the Prescription Drug Abuse Prevention Plan in 2011 stood up by our office, all of the President's efforts have been guided by science, research, and input from public health and public safety officials nationwide. And they're designed to help move us out of the grip of this epidemic. On funding, the President signed a bipartisan budget agreement in December that included more than $400 million in funding specifically targeted at addressing the opioid epidemic. The agreement, I'll be our cheerleader here. The agreement also revised a long-standing ban on using federal funds to support syringe service programs, which can help reduce the outbreaks of HIV and viral hepatitis. And in February, he announced his new fiscal year 2017 budget request, which calls for $1.1 billion in new funding to expand access to treatment for prescription drug abuse and heroin use to help people seek treatment, complete treatment, and sustain long-term recovery. This includes expanding treatment to areas where there aren't enough providers. It includes $10 million for a pilot project that would allow physicians' assistants and nurse practitioners to prescribe buprenorphine. Woo! Woo! And funding for law enforcement efforts to address heroin trafficking. Significantly, the President's budget represents the first time in history that our country plans to spend more on treatment and prevention than law enforcement activities. And in Atlanta last week, he called on Congress to fund this so that we can get started. That's because President Obama believes that we have the power to end this crisis, and that treatment should be accessible for everyone who wants it. So that's a bit of what the federal government's been working on. And the good news is our work to prevent illicit substance abuse is making a difference. We know that overall past year, use of illicit drugs among youth went down between 2011 and 2014. And new non-medical users of opioid pain relievers among people 12 and older is down significantly from 2012 levels, more than 24%. But we still have a long ways to go. And everyone in this room has a role to play. You can make a big difference by being aware of the signs of substance use disorders, expanding your training to treat them, and breaking down the stigma against people who need treatment and effective treatments like medication-assisted treatment. What you're doing, what you're doing with Project ECHO is a great start. You've built the infrastructure to expand access to treatment for people throughout New Mexico, across the country, and around the world. You're building the expertise and capacity on a variety of conditions, including substance use disorders, and you're making a difference in people's lives. But if we're going to end this crisis, we all have to do more. We have to integrate treatment for substance use disorders into primary care and intervene at the earliest possible moment in people's substance use disorder. The Affordable Care Act requires health plans to have parity. That is, people with substance use and behavioral health disorders can get treatment just like someone with a physical ailment. We typically wait until a person is at his or her worst part of this disease before getting them treatment. We don't do this with any other condition. If someone shows up in your office with chest pain, you run tests and immediately begin treatment. We should be doing the exact same thing for the symptoms of substance use disorder. Now, parity is a big step forward, and as I mentioned, President Obama just announced a task force to make sure parity regulations are being correctly implemented. We also have to look at models for care delivery, including Project ECHO, and we have to replicate the most successful aspects so that we can deploy them and treat people before it's too late. Now, Director Botticelli has held a number of community forums across several states and has met many people who have told him, and actually I think many of us have heard this, that people who are looking for treatment experience stigma when they tell people about their disease. And we know that not only do they experience stigma when they're seeking treatment, but often they don't get the treatment. Research has shown us that when we use judgmental terms to describe someone with a substance use disorder, like addict or abuser, they're less likely to receive or be referred to treatment. We need to replace yesterday's words, like addict and abuser, with words that don't encourage stigma. You all know that individuals are not their disease. We need to make the effort to change our language by beginning with the person and not the disease. We can help end the stigma, stimulate more research, and help people live longer and healthier lives. Closely related to this is the stigma associated with medication-assisted treatment. We know that treatment is the key to recovery. I just noticed Steve going like this, and I wonder if people can't hear me. Closely related to this is the stigma associated with medication-assisted treatment. We know that treatment is the key to recovery, and that medication-assisted treatment is underutilized in many places. But it's a critical tool to help people recover. And people in treatment need to have access to every treatment option, because what works for one person doesn't necessarily work for another person. It is terrific that you all run that weekly TeleECHO clinic that uses buprenorphine, and which has been expanded to reach and train practitioners to some of the most rural and impoverished areas in New Mexico. You have the power not only to improve people's lives, but also to break a barrier and get your colleagues to understand that they too can treat medication-assisted treatment and get them on board with medication-assisted treatment so more people can get the help that they need and get it in a timely manner. In Atlanta last week, the president proposed doubling the number of patients each trained practitioner can treat at any time, from 100 to 200. So each of you can double the number of patients that you can treat and give them access to buprenorphine if they have an opioid use disorder in your community. And in New Mexico, I do have the pleasure of announcing that SAMHSA is holding a buprenorphine training together with the New Mexico Medical Society and the New Mexico Hispanic Medical Society this summer. This program will provide the training that physicians need to become certified to provide buprenorphine to their patients. We're doing this to expand the network of trained providers with the goal that one day, no matter where you are in New Mexico, if you need treatment, you will be able to find a buprenorphine provider within a reasonable driving distance. This is a great opportunity, and I encourage all of you who live in New Mexico and are qualified to take the training and get certified to treat your patients with buprenorphine. Training and education are key ingredients to ending this crisis. In this context, I'm referring to prescriber training and being able to recognize the symptoms of a substance use disorder and intervene. And this is where Project ECHO can play a big role. You can use your expertise to help practitioners throughout your network to recognize the symptoms, diagnose the condition, and get their patients into treatment as soon as possible. People need to get help before it's too late, not after they've experienced an overdose, but before their disease progresses to that state. And the same goes for prescriber education. Consider this: the average amount of time that the average medical student spends on prescriber education for pain management is less than 4 hours. Sorry, it's less than 11 hours. My bad. It's 11 hours over 4 years. On top of that, prescribers don't always use the tools that are available to help them, to better manage their patients, including the state prescription drug monitoring programs, or PDMPs as we call them. 49 states currently have a PDMP operational in their state, except for the state of Missouri. A recent study on overdose victims illustrates why using your PDMP is so important. An evaluation of recent healthcare claims data found that the majority of non-fatal opioid-involved overdose victims were receiving an opioid from a prescriber at the time of their overdose, and that 91% of victims received an opioid prescription again from a prescriber following their overdose. This includes a prescription opioid or a heroin-involved overdose. So there is a real need to get more prescribers get the training they need to know their patient's overdose history and to use the tools at their disposal. And with the hub and spoke infrastructure that you've built, you're perfectly positioned to spread this awareness and knowledge. Project ECHO is a great model for expanding access to care. And thank you all for what you're doing. You are a force multiplier, and you can use this power to help the millions of people with substance use disorder live healthier and more productive lives. You can reach people where treatment for their substance use disorders doesn't exist. You can catch them before they fall. And that's what we need you to do so that we can end this opioid overdose epidemic. As healthcare providers, you can be catalysts for change. You can mentor those joining your profession. You already mentor physicians and practitioners through Project ECHO's hub and spoke model. You can get trained to treat your patients with medication-assisted treatment. You can talk to your colleagues and change their thinking around substance use disorders. You can break the stigma, and you can save lives. As President Obama said in West Virginia last October, when it comes to treatment and recovery, those things are possible if we work together. So the President, Director Botticelli, and I believe that if you all do all of these things and we all work together, we will make real progress in ending this crisis. So I thank you so much for your attention, and I wish you a great conference, and have a great day. Thanks.